Yes, delighted to be joined now by the Health Secretary, Matt Hancock. Good morning to you.
Good morning. How are
Good
you?
morning. You're very well indeed. It's almost you're never off our TV screens at the moment. Good to get you up early to hear from you here on Talk Radio. Let's talk about your test, track and trace app. Started those trials in the Isle of Wight last night. Everyone's been told to download the app on their smartphone. If the trials go well, you're going to expand this across the whole nation. A lot of people asking though why you're using an app that is very different from that used in, say, Ireland, Germany, and elsewhere in Europe, and that may not be compatible. How is that going to enable us to go and travel in the future?
Well, there's lots of countries that are developing apps and developing them, each developing them in different ways. It may be that if you want to travel to a country, they may say, please download our app. But these things are not exclusive. And we talk to lots of other countries about how we develop the apps. The most important thing is that here, people should download the app because that will help us to protect the NHS and save lives. And by getting the R down, the reproductive rate of the virus, it'll help to stem the spread.
I mean, some people were concerned about the issue of privacy. I have to say, as my guest Eric myself this morning, pointing out that actually, quite happy to give a bit of privacy, stuck in our homes day in, day out.
Yeah.
But
Yeah.
other tracing apps, the idea is that there's no centralised database. You want to have a centralised database. You want to have an idea of where there are outbreaks around the country. How significant is that? How important is that for you?
Well, we do because that helps us to manage the pandemic. Because if you can see where people are reporting that they've got symptoms, then you can see where there might be outbreaks, and you can go and really focus in on that. So that is an important feature of it, and it means that in the same way that at the moment, if you have symptoms, you can put them in on the NHS website, and many people do, and that helps us. Just by asking people their postcode, not their full address, their postcode, it just helps us spot where in the country there might be a problem bubbling up. So there might be an outbreak in, I don't know, a town somewhere and we can then go and send in the public health experts, make sure that in that area we really grip it so that it doesn't spread more broadly. So that is an important feature of it.
Okay. Now, I know that you gave good reasons, as did the Chief Medical Officer and the Chief Scientific Advisor, about why you abandoned the testing and tracing in mid-March when there was an explosion of infections. In hindsight, looking back now, do you think it was a mistake for the government not to continue that testing and tracing regime in mid-March?
Well, I think that's it's not quite how it was at the time, because on testing, we were constantly increasing the number of tests. The problem was that the epidemic spread faster than the growth in the number of tests. So it wasn't that we abandoned it in any way. It's just that the epidemic, because it was doubling every 3 to 5 days, it got ahead of the number of tests. And we've been ramping up the tests, as you know, as fast as we can. And, I set an ambitious goal of getting to 100,000 tests by the end of last month, which we've hit. And we've now got that capacity. It's going to keep growing, but we've got the very large scale capacity to do the testing. And also, when you've got the virus in large scale in the country and lots of new cases, this sort of technology doesn't work as well as when you've got a relatively small number of new cases. And as we were talking about before, with the if where you see a case pop up, you immediately get in there, contact the people that person's been in contact with, make sure that they know what to do, and make sure that they stop passing it on to anybody else. And that way you really try to grip all of the new cases. And that approach can work when the number of new cases is relatively low. We did it at the start, as you said, and now we can do it because the social distancing is working. But
Can I also ask you? Apologies. It's difficult doing this on the lines across the country, of course. Can I ask you about the Imperial College modelling that we have been using for the government's plan to put us into lockdown? That modelling, exactly the same modelling they did for many other countries. Under the Imperial College modelling that we are using, which predicted, up to possibly 500,000 death toll here if we didn't go into lockdown. That modelling predicted 40,000 deaths in Sweden if they didn't go into lockdown by the start of May. The actual number of deaths is now under 2,700. It's the same modelling that we're using in this country. Is it possible that we could have not gone into a full lockdown and we could have instead done the social distancing that Sweden has done and still have escaped without a death toll in the hundreds of thousands?
Well, there's two answers to that question. The first is that I'm sure that afterwards there'll be a big look back at all of these things, but you have to act as a minister with the information that you got at the time. And clearly we could see the number of deaths rising. It wasn't like this was just some model on a piece of paper. We could see it happening. And the second is that actually in Sweden they basically have gone into a broadly similar lockdown. They're not policing it in quite the same way. But Sweden's quite a different country, and the measures that the population have taken, looking abroad at what's going on abroad, have been actually remarkably similar to other countries.
And do you think overall, when we do come back, and then there's going to be inquiries, and we're going to have comparisons of death tolls across the Europe and across the world, do you think that Britain will come out favourably?
Well, I certainly think that compared to the other Northern European countries, European countries really, we've been in a similar situation. You've got to look at some of the underlying reasons. For instance, there's evidence that there's early evidence of the impact of obesity on your likelihood of getting very serious conditions and entering intensive care. There's also, you've got to look at the population density, because this spreads more quickly in the more densely populated countries. So you've got to look at all of these things. I think that when you just look at the raw figures as a proportion of the population, it's true that Europe has had a tough time of it. And several countries in Europe have got a tough time, have had a tough time of it. But the key question that I ask, as I've said many times on this, in our discussions on this program, is I get out of the morning and think, what do we do now? What do we do next?
Yes.
And there'll be a time for reflection.
Absolutely. Just finally, I know you have to leave. It's gone 7 o'clock. But yesterday, the Department of Health put out a tweet saying there's emerging evidence to suggest the coronavirus may be having a disproportionate impact on some ethnic groups as well as certain genders.
Yeah.
Can you tell me?
Men.
Certain genders.
Men.
Yes. Yes.
It's
There's a little bit of a concern that the Department of Health might not know that there are only two genders.
I think we'll be having discussions, but with the in the department. But there's a there are, just to the last point, right? Men are more likely to die of this disease than women, and we need to understand much more about why that's the case.
So not certain genders, men.
Men, absolutely, yeah.
Good to know the Health Secretary at least knows the difference, even if some of the staff don't. I think perhaps you might need to have a word with your terribly woke social media team.
Leave that to me.
All right.